Hi everyone, this is Alex and Maddie, and we're going to talk to you guys today about probiotics.
So just generally, what are they? Our body has a surplus of different bacterias, and some of them are good, some of them are bad. But when the balance is off between the good and bad, there can be various side effects, like people can gain weight, they can have skin reactions, digestive issues, and other health conditions. But probiotics are thought of as good or healthy bacteria. They aid in our body's digestion along with various other things. They can be found in certain foods like yogurt, cheese, sauerkraut, or they can be taken as a supplement. They also have helped by affecting the nerves associated with digestion. And there are various kinds of probiotics, but some of the more common ones are lactobacilli, bifidobacteria, Saccharomyces boulardii, and each of these has a different effect. Who would use them? So they've been used for various things in the past, and they've gotten quite popular recently, but they've been used for diarrhea from infections or antibiotics. They can also be used for irritable bowel syndrome, inflammatory bowel disease, Crohn's, ulcerative colitis, Clostridium difficile associated diarrhea, and inability to digest lactose and other digestive problems. But some people have also used them for various skin conditions like eczema, urinary and vaginal health, allergy and cold prevention, and oral health.
And so Maddie just told you who might benefit from probiotics, and I'll talk to you now why that is. And so the three big reasons why probiotics are so effective is that it improves your gastrointestinal health, it also improves your immune system, as well as other health benefits. And so those who suffer from diarrhea, the probiotics can really reduce this in many forms. So children who have acute diarrhea or those who are taking antibiotics and have diarrhea. Probiotics are also beneficial for reducing crying time in infants with colic, and it does this by it inhibits the bad growth of bacteria within the GI system. For improving our immune system, it really helps decreasing the upper respiratory tract infections, which just improves our overall health, and it can also reduce cold and flu-like symptoms in children. And other health benefits that probiotics have is that it can help with weight management, kind of what Maddie talked about earlier. It can also help reduce anxiety, stress, depression, and anger, and just has an overall benefit to our health.
As far as side effects, ADRs, and warnings, for healthy people, there aren't very many. There's usually minimal side effects, but they may have flatulence or bloating during the first few days of taking the supplement just while their body gets used to it. People with underlying health conditions, such as like critically ill patients, those who just had surgery, very sick infants, or those with weakened immune systems, they may experience some really serious complications, so we want to be careful with them, and they may get an infection. For those with lactose intolerance, they may experience stomach discomfort if the probiotic contains lactose, so they just want to be careful when choosing what probiotic they take. And you also want to be careful when taking probiotics with antibiotics or other medications that affect the immune system or medications for fungal infections. And you also want to be cautious if you get infections easily, have pancreatitis or a weakened immune system, or if you have allergies to any of the elements within the bacteria that the probiotic contains.
In comparing probiotics to other drugs, we found one study that indicated that probiotics is the primary prevention for antibiotic-associated diarrhea. And so we thought this was super cool that with this condition that the probiotics is actually one of the first lines in preventing that. The study went on to further show, though, that it doesn't treat the antibiotic-associated diarrhea, but just a really good prevention mechanism for that. But then when comparing probiotics to other specific drugs, so for example, if in patients with IBS, the treatment for that is you really want to manipulate the gut and the bacteria in the gut. And so what probiotics will do is they'll just increase the amount of good bacteria within the gut, and this will help regulate the bowel function and reduce gas and bloating within these patients, compared to antibiotics, which it can also be used to treat IBS. And their mechanism is that it reduces the bacteria in the gut, which may help relieve the symptoms. The issues with antibiotics, however, in this case, is that it might remove the bad bacteria as well as the good. So sometimes it can take out everything. Another example in Crohn's disease, you want to reduce the inflammation that triggers these symptoms. And we see in this case, probiotics don't really do anything to help this. It's not really shown in any randomized controlled trials, whereas corticosteroids are very effective in reducing that inflammation within the body.
So here's some effectiveness based on science. There have been several studies that have looked into probiotics in relation to digestive disorders, allergic disorders, oral health problems, colic in infants, liver disease, and the common cold. And they kind of did a few things, but overall the effectiveness is still under investigation. There is preliminary evidence that looks promising for probiotics being beneficial towards diarrhea associated with infections or antibiotics and IBS, but there's still further research needed to verify this. Overall, there's just a lack of evidence outlining the best types and best dosages for people. Because there are so many types of probiotics, it's hard to know what will be best for the patient and how much they should take. And the FDA has not approved any probiotics for preventing or treating any specific health condition. So, although they may be useful, they aren't the first line for certain health conditions. And some have questioned whether the rapid growth in use has outgrown the scientific research.
Our study overview and the popular opinion showed that probiotics are a dietary supplement and they're not covered by medical insurance or regulated by the FDA. And the reason for this is that the quality, purity, and viability of the probiotics are still very variable. The study included a therapeutic algorithm, and what this showed is that probiotics are usually administered as additional therapy rather than first line therapy. And it really depends on the clinical case, the patient interest, and the clinician's preference when using and administering the probiotics. And the reason for this might be that because one probiotic doesn't fit all GI illnesses, and the selection should be based on clinical indication and dosage used in clinical trials. Probiotics, however, are usually safe and there are very rare complications with it, so there shouldn't be any concern when prescribing them to your patients. The perspective of probiotics is very promising, where there's advance towards using them in clinics in the near future. And the results show that the probiotics do have a modest effect insofar as that they are used as a supplement rather than to replace any conventional therapy.
So, when our family member comes to us wondering whether or not they should take the probiotics, we first off want to ask some preliminary questions like, what is their rationale for taking the probiotics? Have they tried any other methods to fix the problem that they are having? And have they looked into probiotics, the different types, and what have they found? And as far as advice, we would definitely want the family member to talk to their health provider before taking probiotics, especially if they're pregnant, thinking of becoming pregnant, or have an underlying health condition. And then if you are taking for antibiotic-induced diarrhea or viral gastroenteritis, then the research suggests that this may be helpful for your symptoms, but either way, your symptoms will probably go away fairly quickly. And depending on the reason for taking the probiotics, there might be alternatives that have more scientific research about their effectiveness, so there might be choices that would better suit your family member rather than probiotics. And each probiotic is different, so you'll want to tell them to look into the different effects of each strain in relation to the effect that they want. And if they have IBS or other digestive conditions, probiotics may be helpful as an adjunct or an addition to some other type of digestive medication.
So, overall, probiotics have become very popular in the recent decades to support digestive health as well as other health conditions. Unfortunately, there is little evidence that gives specific information about the distinct strains of probiotics and what conditions they may help. And it showed that conventional therapy should be used over probiotics in most cases as of now.
And these are our references. Thank you.